Getting back to affordability, universal single payer would save more than $400 billion of the $2.4 trillion consumed by our current for-profit system, even while extending full comprehensive coverage to every American.
That's a savings of about $1,400 per person. How's that possible?
Because private health insurance companies are so inefficient, we can save more than 20% right off the top in overhead alone. As you can see in the second bar, the public option would save very little because all the private insurance companies remain in the system with all their waste and inefficiency. In the third bar, single payer brings the total overhead down to less than half that of the current system and cuts the insurance portion to less than 30%.
All right, but even so, it'll still cost something. Now, you said we won't have premiums, so where will the money come from?
Most people don't stop to think about it, but our existing taxes already provide 60% of the private insurance industry's income, so we, as taxpayers, already pay the lion's share of health costs. In addition to Medicare and Medicaid, our taxes subsidize all medical deductions on taxes and the health insurance costs of every federal, state, county, and municipal employee, including Congress and the President, even though their plans are administered through private for-profit companies. This already existing flow of tax money would simply be used toward paying for the much less expensive single-payer system, where administrative costs would be only about 3 cents of every dollar, instead of the current 23 cents per dollar. And we would not be paying investor profits or maintaining billionaire CEOs. Here's a breakdown of the cost of the current system compared with the cost of those same categories under single payer. In the first line with numbers, Medicare and most other federal health programs are already government run, so there would be no significant savings. The government employees programs would have a 20% administrative savings, about $22 billion, because these are currently administered by private insurance. This is the total current cost of all federal programs, compared with their cost if we had single payer. We'd also get a 20% administrative savings, about $145 billion, on covering everyone not employed by the government, but covered by private insurance. This $723 billion is the amount we are all now paying in premiums alone. For single payer, we would pay no premiums, and the amount the government would need to cover everyone who is now covered drops to only $579 billion. Under single payer, there would be no significant out-of-pocket costs, since it provides truly comprehensive coverage. Here we've used the most pessimistic prediction of the additional cost to cover all the uninsured, and it's only about 56 cents per day per taxpayer.
Wow, so an extra 56 cents from me and every other American per day would cover everybody who is now not insured? That's not even the cost of a cup of coffee.
That's right, and this brings the total cost for single payer to $1,992 billion, as opposed to the current system's $2,400 billion. So, single payer would save over $400 billion of what we currently pay. Now we subtract the existing taxes because we've already been paying those, and that wouldn't change. Those taxes would simply be used toward paying for single payer. The $789 billion in the last line of numbers is what the government would need to collect, which is about $1,400 less per person than what you are now paying in premiums, co-pays, and out-of-pocket per year. But even though it is less money, it would completely pay for single payer for everyone, including all now uninsured.
Wow, $400 billion. That looks like a huge savings. So, if we wouldn't be paying premiums, how would the $789 billion be collected?
Actually, there are many ways it could be done. And these are just a few that would not adversely affect the middle class or poor, and instead will legitimately pay us back some of the money Wall Street stole from us as they led us into the current recession.
I definitely like that idea. They got off scot-free, and that's just not right.
First, rescinding the tax breaks to the wealthiest will provide $250 billion. The second repays us some of Wall Street's ill-gotten gains. The total of NASDAQ and New York Stock Exchange transactions is $90 billion a day, so a small 2.4% tax on speculative stock and currency transactions provides the remaining $550 billion. Along with the lapse of the Bush tax cuts, this would cover what we need with about $11.6 billion left over, and that's about $38 per American. Third on this list is the foreign exchange market. where transactions are about 3 trillion a day. So a tax of only 11/100% would bring in 858 billion, and by itself that would cover the 789 needed with about 69 billion left over. This could provide every American $226 stimulus, or begin paying down the deficit, or whatever. This idea has been around for a while, and I think its time has come. I think it was first called the Tobin tax. Now, these two transaction taxes are basically gambling taxes on the wealthiest speculators.
Well, those all sound good to me.
Well, let's move on to the next thing on your want list. That's accessibility and eligibility.
Now, you said a little while ago that we as taxpayers are paying for emergency room services for those who are not insured. But why are so many Americans not insured?
Because many just can't afford it. They've been denied coverage or they're underinsured. Private insurance companies exist to make money for investors. The CEOs of those companies that produce the greatest profits are rewarded with enormous salaries, bonuses, and retirement packages. Insurance companies lose money every time they pay for providing services, and they make money by denying services. If they do insure a high-risk patient, they either exclude coverage of any pre-existing condition or raise the cost of covering the condition sky high.
So, what do you mean by underinsured?
Well, many people think they are fully covered. Well, they really aren't. They just don't find out until they come down with one of the conditions not covered. High deductibles and copays and low lifetime caps that can financially overwhelm people. If you're seriously ill, or if they discover you had a previous illness, insurance companies can simply rescind your policy and make you uninsurable. And even if you are fully insured, services are often denied for failure to get prior authorization.
You know, now that we're talking about this, the other day my neighbor said her employer canceled her health insurance coverage. I know that she and her family were all on it, so it was probably pretty upsetting for her.
Well, unfortunately, employers often have to decide whether to buy insurance for the workers or keep the business alive. Here's another slide showing just how serious the problems with access to health care is in this country. Well, since this chart was made, the American Journal of Public Health cites a new report out of Harvard that states our actual number of deaths due to lack of insurance is more like 45,000 per year. As you can see here, naturally, death rates increased with age.
Well, but wait a minute. People over 65 don't have insurance-related mortality? How can that be?
Because they already have single payer.
But, oh, I get it. They have Medicare.
Hey, you're really smart. Let's move on to the next want on your list, quality.